Welcome to Division 18's Town Hall that's focused on APA's equity, diversity, inclusion, strategy, and resources. I'm Tiffany Fennell, President of Division 18, and our guest today is Dr. Vanessa Hintz, our Senior Director of Equity, Diversity, and Inclusion, Engagement and Outreach at the American Psychological Association. As you may be aware, APA has really taken many strides over the past recent months, especially focusing on more EDI efforts and developing tools, and there are many other initiatives underway. And so I'm really pleased that Dr. Hintz is with us today to tell us more about those initiatives and resources. And so let me give a quick introduction, and then I will turn it over to Dr. Hintz. So Dr. Hintz is a licensed clinical psychologist, workshop leader, and keynote speaker. In her career, she's worked in a variety of clinical settings with children, adolescents, and adults, presenting with a wide array of issues. And she's an active proponent of multicultural practice and theory, and works dynamically to understand how individuals make meaning of the world within their own various cultural contexts. Dr. Hintz is also a self-proclaimed psych geek and incorporates elements of popular culture into her work when it's beneficial. She's engaged with practitioners and scholars in academia, consultation, and training, utilizing expertise in psychology and human behavior to provide insights focused on principles of equity, diversity, and inclusion. So I'm just thrilled that you're making time to meet with our division today, Dr. Hintz. And so I'll turn it over to you.
Awesome. Thank you so much, Tiffany. Good afternoon, good day, good morning, everyone, wherever you are in the world, in the country. So my name is Vanessa, as Tiffany mentioned, and I work in the EDI office at APA. And so I do have like a very brief presentation prepared, just really to keep me on track, because I get off track very easily and I'll just start talking about something else. So I want to be able to make sure I disseminate this information. There should be plenty of time though, after getting through all this information, to sort of engage in open dialogue. So I invite you all, any questions that you do have, please absolutely pop them in the chat, or you can save them to the end. Whatever works for you. I am very bad at looking at the chat while I'm talking. So if there's something you need me to know immediately, you could just start talking, because it's very hard for me to do both. But okay, so I'm going to talk a little bit about the EDI framework, some of our EDI resources. Okay, so these are some objectives that really I put because I have to. I'm really not focused on any of this. But we are going to talk a little bit again about, to Tiffany's point, the work that we've been doing in the EDI office, and how that sort of, the hope is that that will sort of bi-directionally influence the field and ultimately society writ large. And so before I start, I just want to acknowledge I'm here in Milwaukee, Wisconsin, at Waukesha, which is a suburb of Milwaukee. And I want to acknowledge the first peoples of this land. I'm not going to disrespect them by trying to pronounce any of these words and saying them incorrectly, but I will acknowledge that I'm basically living, working, breathing on stolen land that is not mine. And again, if anybody has any interest in figuring out whose native land you may be residing on, working on, there's a number there that you can text, and they text you back immediately with the names of the tribes that settled your land. And so I also want to acknowledge that it is absolutely impossible to separate the history of psychology from the histories of colonialism, enslavement, and other systems of inequity in America. And so I want to acknowledge too that inequity continues to persist. That's pretty much why I have a job, because inequities continue to persist. And so I just want to acknowledge that a lot of the things that we're going to be talking about today, even though they can sound very abstract, are rooted in people's identities and people's lived experiences. And so speaking of identities, I always do this. I always introduce myself in a way that is like over the top dramatic, but mostly because I feel like a lot of what we talk about in the space of EDI is rooted again in identity and is rooted in community. And so the place from which I'm speaking is more than just as an employee of APA, and more than just as a psychologist, is rooted in all of these different aspects of my identity. And so I don't want to act like that's not the case. So I kind of just meet that head on. And so again, places in which I find community, as Tiffany mentioned, I'm a clinical psychologist, I'm an early career psychologist. And so I think the fact that that's a designation, early career psychologist, it really means a lot. Working at APA, I think it's a point of pride for me to be in the position that I'm in as an early career psychologist, and sometimes it gives people an excuse not to listen when I talk. And so again, it's just a very interesting dynamic. I think it's also interesting to be a Black psychologist in the state of Wisconsin. This past week, we had our state association convention, and there was no other psychologist of color there besides myself. And I was the keynote, and it was just very interesting. And so I think being a early career Black psychologist in the place that I'm in absolutely influences the way that I move through the world and the way that I work. I'm a millennial. I just want to say that out loud because we always get blamed for stuff as millennials, like debt or whatever we get blamed for. And so that absolutely is a part of my life. Student loan debt is a part of my life. Not being able to own a house, like all these different things are definitely my reality, and I don't always see them as barriers. But again, I think being a millennial in the space of EDI, but in the space of EDI and psychology is also just a very interesting experience because there tends to be very stark cohort differences when we're talking about when people were trained and how they were trained as psychologists. I'm biracial, so the bottom center picture, those are my parents. And I say that because it took me a long time. And when I say a long time, I mean like within the last 3 years or so was when I got to the point where I could very comfortably say like I'm a Black woman. Because I always felt like because I was biracial that I wasn't allowed to say that it wasn't true, that I was too white to be a Black person. And so I credit, the work that I did in psychology, the work that I've done in sort of being engaged and immersed in EDI and dynamics of power and privilege. And so now I can very, very much say with confidence that I identify as a Black woman, but that was and continues to be a whole journey. I'm a wife, I'm somebody's wife, and my husband he's a white man, and he is a white man from a very small town in Wisconsin, a town where he could point out like, oh, there's 3 Black people and they all live over there, type of situation where they knew everybody in their town who wasn't white. And so that too is just it's a thing. It's not a good or bad or otherwise thing. It's just a thing. It definitely influences the way we move through the world. The things that we sort of encounter are the same things that my parents encountered in the 80s. Maybe that's why they didn't stay married very long. I mean, they stayed married for like 3 years, but that we encounter similar things as an interracial couple. And again, I'm not, it's not bad. It's just something that we experience. And then lastly, Tiffany sort of referenced this, but I'm a huge nerd, like beyond. It's something, it's like a part of my life. It's a part of my identity. It's part of the work that I do. All the publications, all the study that I do is related to pop culture. And so it's cool. It's like a cool thing. And people are usually like very surprised. So again, I do all this not to just talk about myself, but really to, again, situate myself in the ways and spaces that I find community, because none of this does not influence the way that I do my work. You know what I'm saying? And I just want to, again, meet that head on. And so the last sort of piece, the second to last piece, I'll say with regard to context setting is, whenever we engage in conversations around issues of identity, around issues of EDI, it can get like weird, it can get uncomfortable. And so this is borrowed from the work of Glenn Singleton, Courageous Conversations About Race. We're going to talk about race today, but also a whole lot of other things. And so I just invite everybody to sort of take in these understandings of the space. So staying engaged, whatever that looks like for you, it's like the middle of the day. So whatever engagement looks like for you at this point in the day, I invite you to just do that in a way that's authentic to you. I invite everyone to experience discomfort. No matter how many times I give this talk or give talks similar to this, there's always a point where I feel uncomfortable. And I think that that's like my own issue, but I also think that that is, a precursor for growth. It's a precursor for change. And so I invite us all to experience discomfort in our various ways. What I don't invite and what I don't hope for anyone is that anybody feels at all psychologically harmed by anything that we talk about, because psychological harm is damning. It's very damaging, and we don't want nobody to feel that kind of way. So again, take care of yourself as needed. Speak your truth. You're one of one. There's nobody else on this earth that's like you. So your truth is your reality. And just like my truth is my reality, I'm not here to tell anyone how to be or how to think or how to speak. And then lastly, expect and accept non-closure. We did not get to this place as psychologists, as a society overnight. So this one conversation, we have 500 conversations. It's not going to fix it. And that's okay. That's okay. I think we just have to accept that this is a process that doesn't have a destination. This is a process that really is never going to be resolved, and that's okay. And we can walk away from this space with more questions than answers, and I would, identify that as a success. Okay, this is really the last thing that I'm going to say in terms of context setting. So EDI, DEI, JEDI, social justice, all these things, right? Like there's a whole bunch of things. Like, what does that even mean? So it can mean a lot of different things to a lot of people. This is what it means to APA. So these are the definitions of equity, diversity, and inclusion as they're outlined in the EDI framework. And so when we talk about equity, and again, this is just to contextualize, this is just to give a perspective. This is not like the Holy Grail. This is just a perspective, right? So equity is attributing resources based on need. Very different than equality. Equality is everybody gets the same thing no matter what. Equity is about need. So what you get is based on what you need versus, again, everybody getting the same thing. And again, just to reiterate, equity is an ongoing process. It's not a thing that one day we're going to look up and the world is going to be so equitable and utopian and it's going to be so great. That's just not how we are as people. And I think that, again, that's not to, be cynical or negative or pessimistic, but more so to understand that we have to maintain a vigilance as we engage in this work. And then when you think about diversity, diversity is what is. Diversity is like, okay, we can look around this room, we can look around wherever, okay, there's diversity up in here. And diversity, I think it's important to understand that two things. One, that people are intersectional. So diversity is not just about race. Diversity is not just about gender. Diversity is not just about sexual orientation. It's about intersection. People are intersectional. So I think we have to remember that people are beautifully complex. I think we also have to remember that, our identities hold different salience in different contexts. So I mentioned that, I'm a Black woman. I'm also a light-skinned Black woman. So that gives me privilege in certain contexts. I also have a doctorate degree that gives me privilege in certain contexts. So, you know what I'm saying? Like where we are and what spaces we exist in, our identities can have different salience. So diversity and even the way that we're sort of valued, for lack of a better word, in certain spaces can vary. And then lastly, inclusion. Inclusion is an action word. Inclusion, it's not really probably, but I'm saying it's an action word. And inclusion is about cultivating a space and environment where everyone feels free to show up as their authentic self. So I don't feel like I have to be anything other than what I am. And that's another reason that I do that whole dramatic introduction at the outset, because I feel like it gives me permission, for lack of a better word, to show up that's my authentic self. And so inclusion and fostering environments of inclusion are about fostering spaces where, again, people can be valued no matter how, the same way, no matter how they show up. And that's sort of what we're working to do. And so that was a whole lot that I just said at the beginning. So I definitely want to hear from you all. This is an interactive poll. So if you're fancy, you can take a picture of that QR code. If you're not fancy, you could just go to this website, slido.com, on a phone, on the computer you're at, like whatever works either way. And when you get to this website, slido.com, it's going to ask you for our event code, which is 816462. And we just have two questions that I want to hear from you all at the outset. And the first is, what, if any, barriers to engaging in EDI work have you experienced? And that could be in this division, in your life, in wherever. What barriers have you experienced, if any? Yes. And as responses come in, I just invite you all to take them in. Undoubtedly, every time I do this, somebody types the number in, so it's all good. But I invite you all to just reflect and see what things appear on the screen that you feel like, okay, I can dig it, or what things do you see on the screen that you don't agree with in any way, shape, or form. Beautiful. And you can put as many words in as you want. Ooh, yes. And we'll give it just one more minute, and then we'll move on to question 2. Yes. Oh, this is a word cloud too. So the words that are really big are the words that people responded to most often. Those are the most frequent responses. Excuse me. Beautiful. So for the sake of time, I'm going to move to question 2, but this will be open for you. And also you can keep this open wherever you have it, because when we get to the Q&A, if you feel more comfortable submitting your question anonymously, you can do so through the same platform. And so the second question before we move into our discussion is, what do you hope to get out of the time that we have together? Because clearly I have a whole bunch to say, and I want to make sure I say it in a way that is valuable to people based on where they are. Oh, yes. Beautiful. Ooh, okay. Somebody came ready today, not appropriating. Okay. I love it. Beautiful. And like the other poll, I'll keep this open so you can continue to respond. And again, you can always go back and look and see what other people wrote in an anonymous way. You can't tell who wrote what, but I'm going to move forward then and just give sort of my I always call it a little spiel. It's really not little, but give my whole overview about the EDI office at APA, and really talking more specifically about the work that we're doing now. And so this is the EDI team. I say that we have 6 people, even though you see 7, because the 2 people at the end are like halftime. And so Dr. Maisa Akbar is our CDO. And then so we really just have like 5 full-time people and 2 half-time people. And so I always say that because these are all the things that we do. And so when you think about all the things that we're sort of responsible for, and there's only 5 people, like sometimes it's the most, a lot of times it's the most. It's a labor of love. But just to sort of summarize this, we're responsible for basically, so the EDI office is brand new, not brand new, that's dramatic. It's newer. And so a lot of what we're doing, there's no sort of blueprint for this. We're sort of building that. We're building out the structure, building out the strategy. So we're doing that not only for APA as a organization with a nonprofit with 500 plus employees, but APA as a member organization with 130,000 members. And so we're basically like trying to do these things simultaneously. And I'm blessed because I get to do things like this where I get to talk to people and I don't have to like stay in the tower all the time. I get to come out and do stuff. But I think that there's a lot, there's a lot. And anybody who works in the space of EDI, I think somebody put the word enormity. There's an enormity just within the system of APA, you know what I'm saying? And we're sort of trying to navigate all of those different waters. And so when we think about, okay, well, what does that even mean? What are you even trying to do? That's where we get into talking about the EDI framework. And so the EDI framework is sort of APA's positional statement on EDI. So when we talk about equity, diversity, inclusion, what does that mean to APA? It's in this document. And this document was released in March of last year, and it's available online. It's not really that long. I think it's like 12 whole pages, but the actual text is maybe like 6. So it's not very long. But if you read it again, everything that we have done from March until now, I wasn't there, but from March until now, I've only been with APA about 6 months, but it is all rooted in this framing. It is all rooted in this sort of foundational tool. And I'm going to talk a little bit more specifically about what the frame is. and how we utilize it. And so just sort of overarchingly, the vision statement for APA, an accessible, equitable, and inclusive psychology. And again, that is inherently rooted in EDI principles, and one that promotes human rights, fairness, and dignity for all people. So not just people who are psychologists, not just people who look or think a certain way, but everyone. And so again, I think that we're going to talk about this a little bit later, but that has not always been the case for psychology. Psychology has not always been accessible and or kind to people who are minoritized or people who are marginalized. And we're going to talk a little bit about what that means. And then when we think about sort of like the mission statement that's inherent in the EDI framework, Dr. Evans, the CEO, Dr. Akbar, the Chief Diversity Officer, myself, we're all very biased, but we truly believe that psychology has something to offer the space of EDI globally that a lot of other fields do not. Psychology is the science of human behavior. Psychology has so much richness to offer in the space of EDI because at the core of it, equity, diversity, and inclusion issues are about value. How do we value other people? How do we value people who are different? And ultimately, when there is some sort of injustice, people are devalued. And who better than psychologists understand why that's happening, understand those mechanisms on a micro all the way up to a macro level. And so in addition to doing the work, which is why we're always so tired, because in addition to doing the work internally, it's like, oh yeah, let's like spread the good word about psychology just all through in all sort of spaces in society, which is cool. And there's only 5, 6 of us. So it's a lot, but again, it's a labor of love. And so this is the EDI framework. And I'll admit, when I first started, when I interviewed for this job, I had to give a presentation about the framework and what it was. And I was like, yo, I have no idea because there are too many circles and I don't really understand. There's not like a key, but now I feel like I finally got it. So I'm gonna start in the middle, right? So there's 4 circles that you see here, these 4 concentric circles that you see in the middle that sort of represent this ecology. There's really only 3 levels. It really makes me mad that they put that 4th like little one in the middle, leadership and infrastructure. That is like unnecessary. But there's really 3 EDI levels that we're focused on. APA, again, as a nonprofit and as a member organization, the field of psychology as a whole, and then society. And so when we are engaged in work in EDI, we're really trying to be mindful and intentional about where our focus is. Because oftentimes, and if you read the EDI framework, it's very aspirational. It's very like flowery. It makes people feel good to read it, to say it. And it's like, what does that mean though? Like, what are you talking about? You know what I'm saying? And so this is sort of, again, giving us a frame with which to really be intentional about the work that we're doing. So if we have some sort of initiative or something that we're doing, are we trying to influence APA? Are we trying to influence the field or society at large? So again, that just gives us a way to, again, frame the work that we're doing. And then if you see those labels on the outside, practice, education, advocacy, science, that's the way APA sort of outlines the work of psychologists. So as I did 6 months ago before I took this job, typically psychologists wear many hats. If you're in practice, you're also teaching. If you're in practice, you also do this. And so this is sort of like a very, I don't say this in any sort of negative way, but crude way to sort of try to parse out what does psychology work? What does it look like? It looks like practice. It looks like applied practice. It looks like education. It looks like educating folks, training the next sort of generation of psychologists. It looks like conducting research in science. And it looks like advocacy. So similarly to these EDI levels, when we're talking about engaging in initiatives related to EDI, what are we trying to do? Because all of those different ways of psychology look very different and have very different sort of issues, for lack of a better word. So again, we can't just say we're going to do all of this in all of psychology. That doesn't even make sense because psychology is so diverse. And then lastly, when you see these sort of labels on the outside, access and equity, cultural and emotional intelligence, psychological safety, inclusive policies and practices, when we sort of, those are sort of large general domains of EDI work. So when we are focused on, to use like objective language, increasing something, decreasing something, whatever, we can think about it in these domains. So an example that I'll give, and I'll talk about this a little bit later, but as you all know, the field of psychology is not very diverse. across like racial lines. So we're going to talk about this a little bit later, but psychology is 84% white, 16% people of color. And so one would argue that could be due to one or a number of these sort of larger domains of issues. So when you think about access, we know that people of color don't have the same access to higher education as do their white counterparts. Equity, similar type of field, similar type of idea. Psychological safety, we know that people of color may start out in graduate level programs in psychology, but don't finish because the environment is not safe for them, because psychology is not always kind to people of color. And so again, when we think about, we can frame issues in this way, for lack of a better word, we can also frame our EDI interventions in this way. And all of this is not to make EDI so objective, because I hate that word too, but it's more so, again, to set up a structure of accountability, because so often in spaces of EDI, people have sentiments. And I love sentiments, and I think sentiments are half the battle. The other half of the battle is strategic, like policy change, is structural change. And we can't do that if we don't have a frame with which to operate. And that's sort of what APA is doing with the EDI framework. Another sort of foundational document that we use, the inclusive language guidelines. The inclusive language guidelines came out at the end of last year. And these are guidelines, they're not mandates. They're not, you know, I'm gonna wag my finger at you if you don't talk or write like this. It's not like that. It's more so, again, these guidelines provide guidance on inclusive language, both written and spoken. And so an example I give to people is like, very recently, when we talk about people, you know, matriculating through psychology, we used to talk about people coming up the pipeline. And that actually is an offensive term to our First Nations colleagues and to First Nations folks. And so we have since transitioned to using the term pathway instead of pipeline. And that's something that, like what you would see in the inclusive language guidelines. And again, you can say whatever you want. These are just guides. And again, we also know that as soon as we released this, it was already outdated because language changes so quickly. So this is another one of those foundational documents that the process will be iterative in terms of how we utilize it and different things like that. And so last thing I'm going to move into talking about is sort of what has happened over the past year. And as I mentioned, I think I mentioned this, Dr. Akbar took over as the Chief Diversity Officer at the beginning of 2021. So the EDI office was commissioned at the end of 2018, beginning of 2019. There was a Chief Diversity Officer prior to Dr. Akbar, and then she took the position at the beginning of 2021. And since then, there have been like all the things that are happening. And so I'm going to try to just like quick flyby because it's so much. And so these are some resolutions that were passed by the Council of Representatives related to EDI sort of issues and EDI principles. So there was the resolution on gender identity change efforts, sexual orientation change efforts, and then the human rights framework. And I believe the human rights framework had a whole like task force report. So essentially, like I just outlined the EDI framework, there was a human rights framework developed as well that sort of outlined when we talk about human rights, this is what we're talking about. And so I'm going to move now into talking more specifically about the work that we're doing around advancing racial equity, because I think it gives an example of this sequence that I'm talking about. So again, historically, APA has done things. I'm just going to say things. I'm not going to like put a value on it. APA has done things in the space of equity, diversity, and inclusion. What has not happened is any sort of structure of accountability. So people do things, whether it's reactive or people just do things because of whatever, but it sort of waxes and wanes based on who's in power, based on the composition of the council, based on whatever, right? And so now with this sort of centralized EDI office, the hope is that that is no longer, that just becomes sort of like the fabric of the association. And so it's not like, oh, we're doing EDI now because it's cool. No, it becomes part of the structure, part of the very fabric. And so the way that we sort of do that is, again, we sort of have outlined those foundational understandings. The EDI framework is the foundation. That's our North Star. That's what we go back to. What we just did, and I'm going to talk about this too, is establish a baseline. So what are we even doing right now? Like, what are we even doing? People are doing all kinds of things. How can we establish a baseline of where we are so that then we sort of have this baseline of where we are? The framework tells us where we want to go. How do we get from A to B? Which really probably going to take like 20 years. But how do we get from A to B? And so that is sort of what we've been doing with regard to racial equity. And so this is really, I keep saying this is the last thing, but this is really the last thing I'm going to say, because I basically want to talk about all of that I just said sort of theoretically in very operationalized terms, because this is something that's, even since I joined APA, that we have sort of engaged in from a very, again, from an operational standpoint. And so the work around racial equity in this sort of sequence started in February of 2021, where this resolution on racism was passed by the council, which basically provided a uniform definition of racism. So again, whenever we talk about racism within the association, this is what we're talking about. Two things to sort of outline from that definition. One is that it sort of outlined racism as a system. And so even if we rounded up all the racist people and put them in a truck and drove them somewhere, we would still have racism, because racism is sort of rooted in systems in society. The other thing it did was to provide sort of outline that racism exists on different levels. And so we have internalized, interpersonal, institutional, and structural racism. And so again, if we're thinking about working to advance racial equity, we have to think about it on all of those levels. We just can't change hearts and minds. We have to change systems and structures as well. And so that was the first thing that happened. And then in October, all the things happened. So there was a trio of 3 different resolutions related to racial equity. So the first, and probably the most infamous or famous, depending on where you sit, was the apology to people of color. So APA ostensibly apologized for its role for its complicity in contributing to racial inequity. So accompanying this resolution is a historical chronology that outlines between 1850 and 2020 instances in which psychology sort of failed people of color. And so again, people always ask me like, well, how is psychology racist? You should read that chronology, because and that was commissioned and completed by an external entity. So the Cummings Center at Akron, University of Akron, or Akron University, I don't know, but they commissioned this chronology. So again, that was the first sort of resolution from October. The second was the role of psychology in dismantling systemic racism. So again, when we think about, as I mentioned earlier, psychology has so much to offer in the space of EDI. This resolution outlined in these key areas what we can do as psychologists and with our expertise to work to dismantle racial inequity. And so again, particularly for you all working in public service, there are some, I think, pieces of that resolution that would definitely be much more beneficial to you in terms of the work that you do. And then lastly, we had the third resolution, which was the health equity resolution, that really centered race and racism as the key drivers of health inequity. So we know that there is, if COVID taught us anything, it taught us very painfully so, that there are health disparities between white communities and communities of color. And so this health equity resolution really said, if we want to reduce health disparities, we have to eradicate racism. And so again, that sort of trio of resolutions happened in October. So we had the definition of racism, like, cool, we understand it. We had these 3 resolutions that said, okay, this is where we messed up at, and this is how we need to fix it. And so the next thing that we had to do, I'm not gonna play this video just for the sake of time, but the next thing that we had to do was to establish that baseline. And when I tell you all that this was a whole to-do, this audit, I keep telling everybody it was my second dissertation, because it really was. It was like a whole situation. But essentially, the goal of this audit was to establish that baseline with regard to APA's racial equity work. So what are we even doing? What are we doing around racial equity? Where can we have more of an impact? What should we do next? You know what I'm saying? So APA is really trying to be more intentional about the efforts that we're engaged in, so we're not just working willy-nilly. So the key findings of the audit, just a couple of things that I'll share. One, part of the audit, and I sort of referenced this earlier, but part of the audit was to take an accounting of the racial demographics of both APA staff and the Council of Representatives, because the Council of Representatives, they make all the decisions, right? And so the question was, okay, what is the racial makeup? And we see that, again, the psychology workforce, like, oh my, it's like very disproportionate, right, with regard to white people and people of color. APA also disproportionate, not as much, still disproportionate. And so what we sort of gleaned from that is that there is an opportunity for APA to grow its racial diversity and representation. And when we think about the work that we're doing in the space of in the space of racial equity, there are two things that we found. One, there's a lot going on, but it's very uncoordinated. And so again, everybody's kind of doing things all over everywhere, which is fine. It's not bad. It's not good, bad, or whatever. What the work lacks, though, even from an internal, like organizational perspective, is coordination. So everybody's just doing everything. And so there's like little pieces of impact here, there, everywhere, but it's not focused. It's kind of just like reactive in a way. And what we also don't have is a way to assess if anything that we're doing is beneficial. Because again, people just do stuff. People just go in blindly, and I'm going to do this thing. And then if we ask them like, oh, okay, well, what's the impact of that thing? People don't know. And again, that's not necessarily a bad thing. It also is not intentional. It's not an intentional thing. So we're, again, trying to engage in this work in a more intentional way, again, that maintains accountability. And so the last thing I keep saying that, but the last thing I'm going to say before we go into talking specifically about public service, this is what our timeline looks like. And again, it's another Herculean effort to get to August. So we finished phase one, kudos, high five. What we're engaged in now is, again, really trying to figure out how do we get from where we were, the audit tells us where we are, how do we get from where we are to where we want to be? And we're working to develop a list of actions, again, to really hold the association accountable to advancing racial equity. And that is another whole situation. That's like such an arduous process that usually from an organizational perspective takes like a year, and we have 6 months. We had 6 months between February and August. So we'll see what happens. I'm just going to continue to hope the universe is kind to us. And so what I want to just sort of bring all of this home with is having a conversation more about the work that you all do. And I will admit, I'm a clinical psychologist. So when I was thinking about what does this even mean to be a psychologist in the public service sector, I was like, I don't know. And so then I went and sort of, looked at the website, and this is sort of what I gleaned. And what I wanted to do in looking at this was to really, because again, people always ask me why, which it breaks my heart a little bit, but why does EDI, why does this matter to me? And so I always want to make it relevant for folks. And so this is information that I took directly from the division's website, and I highlighted the relevant point to me with regard to EDI. So when we talk about improving people's lives, I think part of that is having an understanding that some people's lives are impacted by who they are. You know what I'm saying? So when we talk about improving people's lives, I think we have to sort of improve those relational dynamics that like disproportionately affect marginalized people. And I'm not just talking about people of color. I'm talking about women. I'm talking about people in low SES. I'm talking about people on opposite ends of the age spectrum. I'm talking about people from the LGBTQ plus community. Their lives are difficult simply because of who they are. And to me, if the goal for psychologists in the public service sector is to improve lives, we got to work on those relational dynamics. You know what I'm saying? And then I noticed that there were these sort of, I think this is six different sections. And first of all, I just like learned so much. I was like very excited when I was looking at this, but then I was also like kind of sad because when I was looking at this, and this is from my own sort of experience, I think about community and state hospitals, the criminal justice system, policing, psychologists in Indian country, severe and persistent mental illness. All of that, except Veterans Affairs, I immediately thought about communities of color and how communities of color are disproportionately represented in the criminal justice system, and how communities of color, because of the wealth gap, are probably more likely to end up in community and state hospitals. Obviously, people who identify as First Nations folks are people of color. And so again, when I was thinking, and again, that's the lens that I often go to because that's the work that I did before I came to APA, was in the space of, race and racism. But again, then I was thinking about even people at the VA and people at the VA who may, again, have some sort of marginalized identity. What is it like to navigate that space? What is it like for trans people to navigate the VA? When the VA is like, what is the sex on your birth certificate? That's what I care about. You know what I'm saying? And so again, for me, all of these things are EDI issues, and EDI issues that are sort of pertinent to the work that you all do. And this for real is the last thing I could tell by my slide. This is for real the last thing. And so again, I took this straight from the website. And again, thinking about why does this matter? Why does this matter to our division? Why does this matter to the work that we do? And again, I'm just reminded, when you elevate the human condition, my human condition is undoubtedly influenced by like this sort of disadvantages that I experience, again, as a person of color. And again, it's not just about me, it's about all folks. You know what I'm saying? Like the way that our existence, I'm an existential psychologist. I'm always talking about somebody's way of being. Ways of being are influenced by our environment. You know what I'm saying? And so again, I think that EDI is not just an issue right now because it's in vogue. EDI has always been an issue. I just think now people are paying more attention. I also think now people have language that maybe they didn't have before. And so again, I just wanted to close with this, again, just to sort of talk about how maybe sort of engage us in a conversation about how you all feel this is relevant to your work. And so with that, I'm going to stop sharing my screen because those are all the slides, and open it up to any questions that anybody may have, comments about any of that. And again, if you have a question and you would prefer to ask it anonymously, you absolutely